First things first, there are 9,049 cases of coronavirus in Victoria. That is an increase of 384 on our last update. There are 260 Victorians in hospital. 45 of those are receiving intensive care. I'm very sad to have to inform you that the total number of fatalities as a result of this virus has increased to 83. That's 6 additional deaths since we last updated you. If further information can be provided, we'll do so, but the details I can provide you at this stage are 2 people in their 90s, 3 in their 80s and 1 person in their 70s. 4 of those 6 fatalities are linked to private sector aged care. In terms of tests, we have done 1,536,628 tests since January 1. That's 18,521 since yesterday. There are 4,775 active cases across the state. 414 of those active cases are health workers. Some 769 of those active cases are in aged care. That, I think, is probably all the numbers I have to give you. Can I just again take this opportunity to offer my condolences and send my best wishes and support to the families of those 6 individuals who have passed away since our briefing yesterday. This will be an incredibly challenging and sad time for the people who love them the most, and we send our best wishes to them, our thoughts and our prayers. Now, I have a number of important announcements to make today that relate particularly to private sector aged care. I cannot stand here and tell you that I have confidence that staff and management across a number of private sector aged care facilities are able to provide the care that is appropriate to keep their residents safe. If I could say that, I would. But I won't stand here and say that, and I won't stand here also and say, oh, well, this is just a Commonwealth Government matter. We don't run this sector, but the residents in these homes are all Victorians. The Commonwealth Government have asked for help, and that is exactly what my government and our agencies will provide to them. So it is with some regret but a sense of absolute urgency that I need to announce that elective surgery other than for Category 1 and the most urgent Category 2 patients will be suspended forthwith. We will do our level best to honour those booked surgeries, so scheduled surgeries, but that will not run for very long. If you're outside the most urgent of Category 2 or in Category 3, although very little Category 3 surgery is being undertaken at the moment, then we will attempt to have your surgery done, but very soon all of that surgery will stop. So only the most urgent patients will be treated. That is appropriate because that will free up beds and it will free up staff. Staff is the biggest issue. It's not so much about equipment. It's not so much about capacity in a physical sense. It's about having staff who are able to provide care and support to the most vulnerable residents in and coming out of private sector aged care. To that end, I can also inform you, just by way of example, and this will be occurring in many different settings, Eastern Health and the Iron Ear Hospital are closing beds currently. They will then move staff, principally registered nurses, Victorian Government employed registered nurses, into a number of aged care settings where there are outbreaks to provide care and support to essentially take over the clinical care of residents in those settings. Some of the stories we've heard, some of what's gone on in some of these settings is simply not acceptable, and it's not about blame, it's not about demarcations and having disputes about who's in charge of what. It's just about getting on and getting this done. The Commonwealth Government, I've spoken with the Prime Minister, ministers have been speaking, officials have been speaking. It was a very long night, but this is a critical challenge. The Commonwealth have asked for assistance, they've asked for certain things, and that's exactly what they will get. So, just to be clear though, this does not mean that every resident in an aged care facility, a private sector aged care facility that has an outbreak, will be moved en masse to a public or indeed to a private hospital. It'll always be based on clinical need. It will always be based not on the judgment of premiers or prime ministers, but on the judgment of the treating doctor and medical teams, many of whom will have been sent in under these arrangements. Where there is no confidence in infection control, where there is no confidence that care can be provided to a suitable standard, then we will do everything we can to move those residents out. We have the better part of 200 residents that have already been moved from private sector aged care to clinical settings, hospitals, both public and private. Ambulance Victoria has done an amazing job in that effort. And we've also, as you would have seen, one of the most challenging examples to read, and let alone as a family member or a resident actually experience the St Basil's outbreak. We have sent registered nurses in there, Victorian government registered nurses, to support the care and the well-being of those residents. That will continue. What that will mean for other Victorians is that a number of services will have to be constrained. Those procedures will have to be deferred. Ultimately, the sickest people must get treated quickest. And whilst this is not a sector that we have any involvement in, the residents, I stress, the residents are Victorians and we need to look after them. The Commonwealth have asked for assistance and that's exactly what we will offer.